A COVID-19 vaccination campaign is set to begin in Quebec on October 10th as COVID cases continue to rise in the province. To discuss this, we're joined by Dr. Christopher Labos. Thank you so much for your time.
Oh, thank you for having me.
So tell us about this new vaccine that will be distributed in October. It now targets the current Omicron subvariants.
This vaccine that's going to be rolled out is going to be different from the vaccines that came before in that it's a single vaccine directed against the single Omicron subvariant. It's directed against the XBB.1.5 subvariant. Now, that's not the only Omicron subvariant that is circulating right now. You have a few others that are around, e.g. 0.5, BA.2.86. But these are all similar enough that the preliminary data that we have shows that this vaccine is going to offer good coverage against all of them. And so there's good reason to believe that this vaccine is going to offer you good protection against what is currently circulating out there right now.
What do we know about the variants that are currently circulating? Are they more contagious? Is that why we're seeing a rise in cases?
Partially, there is some evidence that they are more contagious. They are similar enough to the Omicron subvariants that came before that they are not drastically different. So they are not, drastically upsetting the apple cart in the same way that Omicron did when it evolved, because Omicron was very different from the Delta variant, which is why things really shot up at the time. They are slightly more infectious, so that's why we're seeing part of an uptick. Part of it is also just the fact that schools are back, that the weather is getting colder, that people are spending more time indoors. So it's sort of a confluence of factors. And part of it too is waning immunity. If you got your last vaccine a year ago or had a prior infection at some point in 2022, you likely still don't have any protection from that past event. So waning immunity is also contributing to the fact that you're seeing cases on the rise.
So what is your recommendation on who should be getting this booster as of October?
The short answer to your question is everyone who's eligible. The slightly more nuanced question is complicated because there is no yes or no. It's not dichotomous. It's not at risk or safe. Risk exists on a spectrum. So the older you are, the more medical problems you have, the more vulnerable people you have in your life, the higher risk you're going to be. Also, the type of job that you have, certain situations just put people at higher risk. So if you're a healthcare worker, you're at higher risk. If you're pregnant, you're at higher risk. So there's a lot of factors that go into it. So risk exists on a spectrum. The point that I like to make to people is that it's not just about mortality. A lot of people say it's like, well, I'm young and healthy, I'm not going to die. That's probably true. But you probably don't want to get sick. You are less likely to be infected if you're vaccinated. That is true, despite what many people say on the internet. You're probably less likely to have long COVID symptoms if you get vaccinated. And trust me, you do not want the symptoms of long COVID. And you're less likely to have complications. So it's not just about mortality, it's about reducing the burden of disease. And you think you might be okay, and you probably will, but you probably are not going to enjoy spending 15 hours waiting in the emergency room to be seen. And in a healthcare system that is stretched as it is, we should probably be doing everything we can to limit the burden of disease right now.
Okay. Dr. Labos, thank you so much for your time.